everybody, and welcome to another Wellness Wednesday. My name is Aurelia Byrne. I'm a registered dental hygienist, and today I have Dr. C with us once again. She's been with us before on a Wellness Wednesday. She has a tremendous story. If you want to go ahead and check out her introduction from our last Wellness Wednesday, you can go to the YouTube channel and watch the full episode. Dr. C, thank you again for being here. I'm so glad that we're going to be doing this once a month with you, because you're so amazing and have such great information to give to the public. And you're a medical doctor, you're a physician, you do everything with 100% passion and heart. So I'm really glad that you're part of this team and helping people through social media. So thank you
so much. Thank you. And thank you for giving me the opportunity to do this, because as a physician, we have our fingers in so many places that doing something like this is just another innovative way to get our message out. And you're right. I definitely can agree with you. I do it with passion because like you said, I have a story, so go find out what that story is.
That's right.
And yeah, that's what drives me.
Yeah. So today we're going to talk about something that's really, really important, and is mental health. And I love that you want to talk about this today, because we talked earlier before we got on about a stigma, but we won't go into that now. But I'm really happy that you're going to be sharing your experiences and your recommendations and what you see, what you're dealing with. What are you dealing with in the realm of mental health?
Wow, that is such a broad conversation, because I'm seeing, maybe I need to preface it that I'm board certified in family medicine. So I'm not a psychiatrist, psychologist, counselor.
Sure.
But I think after having practiced for over 20 years, you kind of pick up a few things and some life pearls of wisdom, as I like to say. But mental health is very important because it is one of the drivers for inflammation that really catalyzes the whole series of events that encourage us to have a vascular event like a heart attack, a stroke, or whatever it is. So it's just one of the many underlying root causes of inflammation. And if you go back to the previous Wellness Wednesday talk, you'll see that there's so many branches to that, or root causes to that, sleep being one, and now stress. Mm-hmm. That's how I kind of have wrapped it up, is stress. It comes in so many different forms. So some of us have survived the last couple of years during this unusual pandemic. And that has been very stressful to, I think, almost everybody. There's financial stress, there's emotional stress, there's physical stress. Financial, many of us could not go to work, could not do things, so we had to make do. If you were a recipient of the government assistance, that probably helped. Sure. Emotional stress is, can you imagine a working mother or a working father that is working from home, plus being responsible for the homeschooling of their young kids, plus making sure there's meals, making sure everybody's safe. I mean, that's a lot.
Yeah.
And that's a certain kind of stress for everybody, the child, the parents, all the caregivers. So we have to acknowledge it. And you mentioned stigma. I think most people do still have the stigma of, oh, I have depression, I have anxiety, I have something more than that, or even worse, I go see a psychiatrist. But you know what? I consider, and I destigmatize it by telling you that, first of all, it's so, it's everywhere in different forms. And it's such an important part to control the overall stuff, right? The overall disease process. And I find that people who do well, let's face it, stress is always going to come in our lives. We can't stop it from coming, but what we can do is learn how to manage it. I talk about resiliency and there is a mental resiliency. It's kind of like that elastic band we talked about before. You stretch it, you stretch it, you stretch it. You hope you don't, you know, break it, but it will come back to its original thing. So I have encouraged people to kind of look at it as elasticity. So we're going to be stretched, but we can always come back. We don't break. And a lot of it does go back to Dr. C's 6 healthy habits, and the foundation was sleep, which we talked about, right?
Yeah.
But in the 6 healthy habits, I talk about stress management, AKA, do you have a hobby or something that you really enjoy that has nothing to do with work and nothing to do with family? In other words, what do you do for you? What do you do for your vital needs that fills your cup? For example, I had a very good friend who is a nurse practitioner, had owned her own weight loss company that talked about the psychological aspect of weight loss. And it was very interesting. She called it the vital needs. That means for me as an individual, what do I need to have accomplished in order for me to feel like, okay, bring on the world, I can do it. So it's so personal. So I'll share you my vital needs. Okay. So I do a lot of driving. So I love to hear educational, in those days it was CDs, now it's podcasts, listen to Audible books on there. So I've got all that. I have my own time in the car, talking to people, listening, and so on. But I also need to have a good night's sleep. I know we keep coming back to that. Other things like I need my environment to be tidy, decluttered, because having a cluttered, unorganized environment, it actually causes stress, mental stress. And I went to a showroom once and there was a couple of ladies that was talking about their business, which is things like building customized closets and stuff like that. And I quite proudly raised my hand and I said, do you realize what you're doing for mental health? And they all looked at me and go, what? I said, you taking care and organizing all our stuff in those beautiful closets is like the equivalent of a mental health medication. Yeah. And it's true. I mean, how do you feel after you've decluttered something? Anyway, that's that. And then other personal things like I got to get my nails done. If I have a chip on my nail, it's like it bugs me, it bugs me, it bugs me. But if it's everything's like my nails are done, my hair's done, I feel like I've got myself together. Now I can help you. So
because now your cup is a little full, because like if your cup isn't full, then how can you help others, right? You know,
it's like the mask on the airplane.
Yeah.
Put it on you first before you can take care of others.
Yep.
So my vital needs, and that's a practice. It's not one and done. It's a practice. And so if you do that regularly, for example, if you have a massage and that makes you feel better, if you have that regularly, then if a stressor comes along, sure, it's stressful, but you've built enough good credit in you that you won't fall apart. Now, if I was sleep deprived, my nail was broken, and some stressor came along, suddenly that issue becomes so much bigger, and suddenly I can't. It's harder to address. Sometimes stresses come in all forms of forms, size, shape, whatever. And I've changed my paradigm. I've said, okay, so this is another thing that's going to hit the fan. Instead of bemoaning it, instead of complaining about it, complain, get over it, and then say, okay, what is it that I'm supposed to learn from this stressor, this challenge? Once you reframe it, suddenly it doesn't become as nasty, right? So the next thing after that is keeping a gratitude journal, because if you practice gratitude, it's harder to get mad, sad, and stressed. So today, my husband is flying off again for another month. I won't see him. And I just got a new dog, and I'm thinking, oh, that's more responsibility for me, da, 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 da. Instead, I turn it around and say, I'm grateful that I can handle it. I'm grateful that he'll come back. I'm grateful that I have a dog. In fact, let me focus on getting those walks in. Let me focus on more of my artwork. In other words, change the way you look at that problem. Suddenly it becomes less stressful. So having a hobby is a really big thing. I am no artist, but I like to do things, and I have a little art place, and I do my paintings. And have I lost you? Okay.
Nope, you're
and
there.
So that helps me. You've seen those adult coloring books?
Yes.
So I've got one with a lot of arabesque kind of designs, and it will take me away to a land where I don't think about anything. Just keep coloring within the lines. That's all. I mean,
I love it.
So there's so many things, but I always encourage my members to think about what rocks you, what makes you feel good, and then use that. You know, another good thing is volunteering. Volunteering is a great way to forget your own stress because there's always someone else. So you see what I'm saying?
Yeah.
Let's acknowledge it. Let's look at ways that we can develop emotional resiliency. But sometimes we do need a little bit more help, and you need to ask for it and get out and find the right person to help you. Sometimes it's our best friend. Sometimes it's our mom. Sometimes it's a psychiatrist or a counselor. But ultimately, when you are looking for someone to help you, it's usually you've got to have a good rapport. You've got to have an understanding. You have to have open communication, no judgment, all of that. That helps a lot. In fact, I highly encourage that if you are someone who's suffering from a mental health diagnosis, whatever it may be, get talk therapy with it. You will do so much better. And that elasticity remains, that resiliency remains, because the stress doesn't end until we're kind of not here anymore, does it? But there's ways we can do it. Try talking to someone who's very young about stress and someone who's well seasoned. And you'll see that as we get older, we choose to stress less about the smaller things, right?
Yeah.
And believe me, you know, we've got a lot of things to stress about in today's day and age.
I know.
So how do you manage that when you've got such negativity coming at you in different directions? It's to go back to what makes you work: sleep, hobby, friends, socializing. I mean, the more isolated you are, the more stress you have does increase your risk for different types of dementia. And dementia isn't something that happens when you turn 60. It starts happening in your 30s. So look around you, be connected to people, help other people, discuss things with other people. Now, there are toxic relationships. So if you feel like those relationships are causing a different kind of stress, I really advise you to step away, because that is counterproductive. All right. You need someone who's kind of belongs to your tribe, who shares common interests, common philosophies. But the best stress buster, I will tell you, second to sex probably, is a good laugh. You know, that kind of deep in your chest kind of laugh that almost makes you want to pee, but that's the best. All right.
I love it.
So don't be afraid to reach out, because there's a lot of people going through what you're going through. And if we all share it, it becomes easier. For example, a lot of colleges are experiencing their incoming freshmen who are really, really stressed because it's so different. The independence, the work demands, having to learn their own boundaries. A lot of these young adults don't cope very well. But what we found is there are some really, I would say at least 200 or more good colleges that have seen that and are, if you like, managing that risk, because they want you to, they've given you a place at college or university and they want you to complete it. And so They have counselors present. They have apps that are available to the college students for free that enables them to access mental health providers, counselors, all of that at the touch of their phone. I mean, everything is done through our phone. So yeah. that's a great thing. And then now, because of the pandemic, we've got telehealth, which is like this, a Zoom call with a provider instead of having to venture out, try and get somewhere. So it's a lot more accessible. So these are things that we're trying to help people access, that kind of talk therapy. Sure, there is medication, but I'm touching on the stuff that you and I can do one baby step at a time. But I do encourage you to build that elasticity, build that credit in you, because who knows what will tomorrow bring. But be optimistic, be grateful, and get your nails done.
Yeah, I think that, I mean, that's great advice. I mean, you have to have a hobby, I think, and you do have to, as a woman, for sure, the nails, the hair, you know, making yourself feel good. That's just so important, because I mean, I know that works for me. Like I always tell Gary, I'm like, oh, my nails, I got to get my nails done. I have to do this Zoom and my hair looks this. And, you know, if I don't feel good, then I don't feel good. So
you don't project it. You don't project it. When you feel confident, when you feel like you've got everything to the best of your ability and you're confident, it shines through you. Yep. So it's very, very important. And it's not about luxury. It's not about those things. If you consider taking self-care basically as a luxury, then you're missing the point. So there's different ways of looking at it. But me as a professional, I start my assessment of every single patient by looking at them. If I know a patient comes in and he or she's got their hair done, they've got, you know, clothes are ironed and so on. And then one day they come in, their hair's ruffled, they're wearing creased clothes, something's up. You watch for their body language. They don't look at you always directly. They may be fidgeting. Their vital signs, their heart rate may be up, their blood pressure may be up. You see, there's so many ways of spotting that. And if you see someone in everyday life that looks like they're having a hard time, just reach out and say, hey, you okay? Can I do anything for you? That may be the only voice they heard all day. So I think being compassionate for ourselves, and as my mom says, it all starts at home, being compassionate to your partners, to your kids, to your everyday surrounding, and then let it ripple out that way.
That's good advice. I'm going to pay it forward all the time.
All the time.
All the time.
You know what? I love the act of giving. I'm not so hard on receiving, but I love to give. And if you can do it anonymously, it's even better. You've got this little warm, fuzzy feeling in your chest all day. And no matter what goes on in the day, you did one thing right.
Yeah, that's good advice too. Well, thank you so much. I think that this was mental health is a huge thing, especially like you said, with all the negative stuff that's going around in the world. I mean, I know you're in Texas, and I don't even want to really touch base on that, but you know, it's depressing sometimes, you know, especially when there's stress. People, you know, I deal with stress. I mean, I'm juggling all kinds of balls here. I got my, you know, different companies. I'm doing podcasts, you know. I mean, and then you got your personal life, and you got to balance everything. And sometimes it's hard. And if you're anything like a perfectionist,
it's even harder.
It's hard. And there's a lot of people out there that are perfectionists. And
so, what was I going to say? I've learned not to be a perfectionist. I've learned to kind of, okay, I'll deal with that. That's fine. Not a big deal. Gosh, I was going to say something.
Well, in social media too, like when you look at social media, I mean, I can't, I mean, I'm older, you know, I'm not, you know, a teenager, or I didn't grow up with, so, and I see this, I'm like, oh, these poor people, they have to think that, and they have to be this way or look this way. And it's a lot of pressure.
It is a lot of pressure. And it takes a very well-balanced, secure person to understand that this is the best of what that person is showing. That's why it's important to connect to people face to face. You see them warts and all, and you just realize that's okay. But it does take time and experience and knowledge to feel comfortable in your own skin. Some of the stress is self-made. But I know I encourage women, especially when they hit their 40s, don't be sad, be happy, because now you can select things that you don't like. And when you hit 50, it's even better. And I think Oprah said 60 is just the bomb. So, you know, I choose to be an optimist, because that's the way to take care of things. Okay.
Always think positive all the time.
All right.
I mean, that's right. Well, Dr. C, amazing. I'm so glad that you came on Wellness Wednesday once again. Next time, I don't know. We'll figure out what we're going to talk about next time. But thank you for being here, and it's always a pleasure to speak with you.
And I think my battery's gone, so that's great.
No.
Bye.
Bye-bye.